Hi everyone, thanks for joining us today as we continue to talk about the jail. And our guest today, we have a really outstanding, wonderful guest, Jelynne LeBlanc Jamison, President and CEO of Center for Healthcare Services. So thanks for being here.
Great to be here.
Yeah, we have a lot to talk about. The Center for Healthcare Services for a long time provided the mental health assessments and care in the jail, as I understand it, right? And that's changed in recent months, right?
Yes.
So what I would like to do today is let's start first with what the center used to do in the jail. Just give people who are watching, listening, just give them a sense of what you all were doing and why the change occurred.
Sure. Well, as far back as maybe 10 years ago, Bexar County was a leader in this area where they embraced diversion, and they wanted to create a number of opportunities to divert individuals from the jail. And so we started this journey with Bexar County as early as 2007, and we've evolved over the years. And for the past 8 years, CHCS has been present at the jail intake facility at both of its locations, the one on Frio and the newer one. And the purpose of us being there is to screen 100% of those individuals screened by law enforcement for mental health or substance use issues and make a recommendation for diversion. And so diversion could look like an outpatient engagement with the center or reconnecting with a community resource for that individual, primarily with Class A and maybe some Class B charges, which are low-level offenses. Knowing that the jail confinement is not the best environment for someone living with a mental health or substance use disorder for appropriate treatment. And so we were doing that, in my view, successfully until September 30 of this past year. Bexar County made a decision, the staff made a decision and a recommendation to the elected officials, a short-sighted decision, I might ask, to remove CHCS and have University Health be the provider for not only physical health, but also mental health. And University Health was doing that already for individuals that were at the jail, but they were not doing it for individuals that had the potential to be diverted. So essentially, Bexar County has now made the decision to keep everyone in jail.
So so diversion numbers are dropping now?
Diversion,
they're already low.
Yeah, they were already low. Unfortunately, Bexar County had developed a process of really only diverting those individuals that were eligible for a PR bond, a personal recognizance bond. And so I think in the year 2025, maybe out of the between 13 and 18,000 individuals that we assess, they diverted just under 130 individuals between two programs, special needs unit and GIA intake.
Really?
Jail intake, yes.
Okay. So we're going the wrong way on diversion right now.
We're going the wrong way of taking care of individuals who need the right treatment at the right time.
It wasn't. I mean, just for people who are listening, watching, the idea was that to kind of like streamline things, that there were a lot of entities in the jail, and so here we'd have one agency handling this. So I think the intentions were good, right?
I think, the recommendations were very clear that there was a need for process improvements and to implement a systemic process or a sequential process for everyone to follow. But I think it was short-sighted to think that the entity that has the authority and jurisdiction to authorize outpatient services, especially those services for individuals that don't have coverage, which quite frankly is the majority of that population, to remove them from that sequential process was very short-sighted.
Right. So, I mean, are you saying that you would have preferred to have seen, could the center have taken on, I know we're kind of down the weeds and I'll zoom us back up, but could the center have taken on the physical health screening too, or you would have rather just kept it on two parallel tracks?
We partner with University Health in many other ways, and we could have continued that partnership with University Health. I would have rather to be at the table. CHCS was not at the table to develop the solution. We should have been. I think we would have brought innovation and a sound recommendation to the table for the commissioners to consider. And I think we would be much further along in talking about the real issue, and that is access to care.
Right.
A facility where these individuals can be diverted and be treated.
So that's actually the main point of our interview today, right? Is that, the center obviously focuses on the people with mental health challenges,
Yes.
and in turn substance abuse, and obviously later over that is the potential for dual diagnosis, suicide risk, all kinds of things that are attached, right? So the goal for the center is to divert people, but even, going back years now, whatever the aspirations are, there's no place to divert people,
Correct.
right? And so that brings us to this point of a diversion center,
Yes.
right? So just for people who don't know what a diversion center is, like real quick, like what would a diversion center be? Like how would that work, and
Sure.
who would you be trying to reach?
It is a facility that would be designated as an alternative to jail. And so because of our state statutes, it would have to be voluntary. But an individual, instead of facing a charge and going to jail, would elect to come to the diversion center. And it's been a model that's been very successfully implemented in Harris County, and we're using Harris County as a model. I've been talking to a number of municipalities around the state of Texas and Dallas. While they implemented a deflection model some years ago, they are now moving to the Harris County model. And this is a location where law enforcement feels comfortable bringing an individual in lieu of taking them to jail. These are primarily low-level offenses. The majority of the offenses are criminal trespassing. But these individuals have been screened for mental health and/or substance use. They have a low-level offense. They are voluntarily willing to come over to the diversion center. The average length of stay is about 14 days. They are observed to really get a handle on the primary diagnosis, and then the treatment modalities begin. That individual is then stabilized and then prepared for a journey in outpatient treatment. And there are after discharge activities that this center would conduct with those individuals as well to keep them on track and keep them in adherence of their medication.
And then, like the obvious benefits are, one, you potentially have someone changing their life, right?
Absolutely,
You're changing people's lives potentially, right? But they're also not in jail, so that jail population, which is basically pushing the limits.
So a couple of things. We're helping law enforcement get back on the street, which their primary goal is to be back in service, to protect and serve this community. And that's a driver for law enforcement, whether they are SAPD or the Bexar County Sheriff's Department. Secondly, our Sheriff's Department is tasked with managing the jail population. And we already know on a daily basis they are taking hundreds of individuals, and they're having to take them to Burnett County or Kerr County because we don't want to exceed the state mandated caps for population at our jail. And so to hold individuals there that have an opportunity to get treatment for low-level offenses, it's almost criminal in and of itself to keep them there when there's an opportunity to provide another alternative for care.
Right. We're spending millions each year sending some inmates to Burnett and Kerr counties. Now, these are inmates who they've been adjudicated. They're going to prison eventually. They're state holds, but the point is we're spending millions to send them there when we could actually be spending millions on a diversion center, and then and then we wouldn't have to ship these inmates to other counties.
Absolutely. So at our last calculation, the day rate for an individual receiving mental health and substance use care at the jail is around $750 a day. And preliminarily, the cost to operate or the cost to treat at a diversion center is between $500 and $700 a day.
So
there's a cost avoidance there, and there's a return on investment for this community.
There's so much to unpack here, and I'm going to do my best to move quick.
Okay.
But so first point is there's a recommendation in a Meadows report from like 2022 about a diversion center, but here we are kind of like still in the early civic discussions around it, right? Like City Councilwoman Terry Castillo is pushing like a city county committee, but the point is it's 2026 and we don't have a diversion center. So what are your thoughts about this? Meadows report comes out in 2022. It recommends one, and we're like just barely in some ways
talking about it. So I'm very aware of the recommendations from 2022. I'm also very aware of the evaluation the county undertook to evaluate its current operation of GIA. And quite frankly, when this latest move by Bexar County to change the operation at GIA, it became very obvious to me what the unintended outcome would be. And they're living it right now because those individuals are not being diverted. They're just sitting in jail. And so I, in discussions with my board, decided that as the local mental health authority, we needed to get out in front of this and begin educating our community about a diversion center. And so we have been having very positive conversations with the community since September timeframe, making them aware of the Meadows report, explaining what a diversion center is, and actually beginning the fundraising framework to begin asking this community to invest in itself and help us create this diversion center. It's gone very well. The City of San Antonio, I will be meeting with our City Council Public Safety Committee. I commend Councilwoman Castillo for taking the lead, and I look forward to the conversation with the Public Safety Committee for the city. I've actually had conversations with the elected officials over at the county, and many of them are very supportive. And so as well as University Health. University Health is really feeling it right now because they are the sole provider. So I have every confidence that brighter heads will prevail, and along with collaboration with our district attorney's office, law enforcement, the two governing entities, the City of San Antonio and Bexar County, we will be able to create a plan. My board has authorized me to issue an RFP to engage a consultant or an individual to help us develop a plan that would determine the size of this facility, make recommendations on the low-level offenses we should focus on, the average length of stay, all of the components necessary so that these individuals can make good decisions.
Okay.
And so that's what I am currently involved in, and I hope in the coming 60 days we will begin that process, and we'll have something to present both of all of the entities so that we can begin the real work in creating this opportunity for the city.
Okay. Yeah. So there's a discussion at the moment about there's this for those who are watching, listening to this. There's this sheriff's training center near the jail. It's a large complex, but it's from my like layman's perspective, it's very run down. And so there's discussions about converting this training center into a diversion center. What do you think about that possibility? And related, well, anyway, let's start there, and then I have some additional questions about this idea.
I don't want to get out ahead of the individual that will help us develop the plan, but I have looked at that facility with our sheriff, and he was just so ready for an alternative. He was offering any facility he had available. And while the internal space might be workable, a diversion center really needs an area for therapeutic treatment, and that particular location doesn't really offer that. And so I'm really anxious about working with the sheriff and others, as well as law enforcement, to determine what's the most viable location that law enforcement feels comfortable accessing, what can we do that's best for treatment of these individuals, and what is reasonable in terms of cost.
Right. Because I've toured that facility with him, and my concern would be that it's almost like a Band-Aid for saying that
Sure.
just, that it's this is something that's really needed, and officials might be tempted to do something kind of on the quick and the cheap. Mm-hmm. And so, look, we can kind of renovate this in some way, and it'll meet the needs of a diversion center. But actually, it's not designed to be a diversion center. That wasn't its original intent. And so I have concerns that it might miss the mark in that sense, and that we might end up in a situation with like the jail intake center where it's not designed right. And
I totally agree with you, and unfortunately that seems to be the mindset with the products that have been delivered by Bexar County. And so, hopefully the elected officials will direct their staff to be more innovative and join us in doing the right thing this time and not placing a Band-Aid. But, you know, I feel for an individual who is subject to getting a budget from another entity and has an available resource and knows they have a need, and they are just looking for a solution.
Yeah.
But Bexar County deserves better, and we need to take a step back and do the right thing and build an appropriate facility so that we can meet the needs of this community.
When I spoke to Bexar County Judge Peter Sakai, he said something to me that we had a spirited exchange about this, but he said that he doesn't need a nice building for diversion. Thoughts on that? And that was literally...
That just lets me know that he is unaware of what a diversion center should be, and he is not educated on what it needs to be for this community.
Yeah. Do you think, there have been 85 deaths in the jail between the start of January 1st of 2020 and the end of 2025. In your view, would a diversion center play any role in potentially preventing deaths?
Absolutely. I recall the young woman that we lost at the end of the year. She was booked on a Friday, and by Sunday, she died by suicide. And do I believe that was an opportunity to engage that young woman and get her into services and she might have a life? Yes.
Yeah.
So it's unfortunate.
Diversion center. So when I've looked at this over the past year, it's almost like we don't have. I guess I'm opinionating here, but I'm an opinion journalist, right? It's almost like we don't have the foundation set for reaching the population that would be eligible for a diversion center or for more serious mental health needs. Mm-hmm. And so they end up in the jail. And then when they're out of the jail, they're just kind of...
Yeah, it's just a cycle.
Yeah.
They get recycled back. I would challenge you to say we don't have all of the pieces that are necessary to come together. I think there are many different entities that still operate in silos. We've done a phenomenal job over the past 8 years connecting our crisis response systems. And I think now we need to take a step back and do a little pre-crisis work and begin to engage with individuals at the earlier time. And so if it means we now need to focus on individuals that engage in law enforcement, unfortunately, because they may be unsheltered and their potential for criminal trespassing, and there's an opportunity to take them somewhere for treatment, so be it. We need to invest in that in this community. And so I don't say the foundation is not there. I say it is there. It's not coordinated. It's not a system of care. It really needs to become a pre-crisis system of care to address this population before they are engaging in crisis and the criminal justice system.
I appreciate that, and I agree. So, so you and we have made what I think is a convincing case for a diversion center, but it doesn't stop there, right? The Meadows report specifically brings up it's a 2-part report for people who are listening or watching, and it's a heavy read. Yeah. So unless you're like super into policy, you can just trust our description here, but it calls for some additional significant investments.
Yes.
And one is a medical detention facility annex to the jail. Yes. And that would be for behavioral health, so psychiatric needs, but also for medical needs, like physical medical needs. So let's talk about the importance of that. And then there's a third recommendation for a psychiatric hospital, because as basically one of the fastest growing, if not the fastest growing metro area in the country, mm-hmm. We just need beds.
We do.
So let's take it one piece at a time. The case, the need and the case for a detention medical facility,
yes.
and then one in the community, a hospital in the community.
Well, this same report that you referenced by Meadows Policy Institute identified the need for a jail, a hospital facility, an enlarged hospital facility to serve those individuals in jail. And unfortunately, this just is a carryover from what's happening at the state level. And so the state hospital system, which if you speak with anyone who's been in the state of Texas for a number of years, they say, well, the state is supposed to take care of the mental health population with their hospital system. That is no longer the case. The state of Texas hospital system is primarily focused on forensic patients, those individuals who are in jail, either maximum security or not, who are sitting in jail with mental health and substance use are now being transitioned to the hospital system by the state. And so the opportunity for the general public is very limited. And so that's been a change. And the general population is not aware of that. And so it now places more requirements on local municipalities to have medical facilities, sufficient medical facilities for their jail population and their general population. And so the report clearly recommended that Bexar County invest in a hospital facility for physical and mental health needs at the jail, which is much cheaper than building a new jail. And secondly, they recommended by 2025, 128 new beds, and then another 300 beds for this community by 2030. We are here at 2030. And they are recommending a psychiatric center for Bexar County.
Yeah.
Because our general population, the center is currently funded for 52 inpatient beds for a population of 2 million. And that is ridiculous. The occupancy rate is at 98% all of the time. And, we simply have to clean the room, essentially. And so the turnover rate is very high for those inpatient facilities. And you can't begin to impact your community in a positive way, increase the life expectancy of our population if you do not have access to care.
Yeah.
And so I have had a conversation with the University Health Board of Trustees and asked them to reprioritize those recommendations out of that Meadows report to look at a detention facility for our jail population and to reprioritize a psychiatric center for our community.
And I'm just curious, what was the response to you?
Well, I think because the report had age on it, I don't know what the follow-on conversations have been, if there are any, with their staff. But they, the feedback after the meeting was, thank you for bringing that information. We are aware. It's something that we need to evaluate.
Yeah.
But I'm not going to let it go. I will be visiting with them again to find out what the follow-on is.
Yeah. In my reporting, when I was reviewing inmate deaths, there was and there are so many different reasons why an inmate might die, and sometimes they're just old, right? And sometimes it's a medical thing that would have happened out in the community. So I think it's important for people to be aware of this. But there was one case where there was a man who was there on felony charges. So this is not someone that would go to a diversion center. Yeah. But he died. He was in what's called the unstable mental health unit. So he had serious needs, and he died in his cell, naked, covered in feces, and he was waiting for a bed at the state hospital. And so when I look at our system, I think, well, that is a failed system. Yeah. Whatever his charges were, then they were serious, assault charges and endangering a child, and whatever his charges were, he still needed medical attention, and the jail is not set up for that. Right. So that's, to me, where it's like we need, like, this has to be built, And again, I think it gets into if this medical center were built for detention purposes, one, the inmates would be getting the appropriate care. Two, like, once again, we get into this capacity dynamic of some people that are in the jail they'd still be in detention, but they'd be in the appropriate settings, right?
Appropriate care. And let me just say one thing. I'm not suggesting that our inmates today are not getting appropriate care. We have some very well-intentioned professionals that operate the hospital with University Health at the jail, but it is insufficient. And I think if they were here, they would tell you that they certainly do believe there are some improvements. There are expansion needs. There are more bed needs for the jail population. And I don't know what they would say about the community hospital, but I can speak as the local mental health authority. There is a need for an inpatient for increased inpatient access to care in this community for a
Yeah.
psychiatric hospital.
No, and I appreciate your clarification because the care is there, but it's the lack of the lack of infrastructure and facilities makes things harder because then people who some of the more serious mental health situations in the jail, they move into what's called the stable unit. Mm-hmm. People who would be in the stable unit move into general population. People who have kind of regular medical needs aren't necessarily in a medical and so UHS staff is kind of going through the whole jail trying to find
navigate.
people as opposed to this is the mental health setting. This
Right.
is the diabetes. This is the detox unit. Things like that. So it's I think it creates a lot of obstacles for them.
Let me give you some additional context because it's just not a local issue. I see on a monthly basis the wait list for individuals statewide waiting for a bed at a state hospital, and that list is 1,400 persons long.
Yeah, it can be 2 years, right?
Right. So it's a bigger issue, and I think we're trying to do as much as we can with the resources we have. But to your point earlier, it's time for us to take a step back and be innovative and strategic and figure this out.
Yeah.
And make the investment.
Well, I think a general hospital obviously would serve the community.
Yes.
But I think if you're talking about the jail and detention, it has the potential to keep people out of jail too, because they're in crisis, but they might be at a place where through the hospital they get stabilized and then never end up in a detention setting.
Well,
right?
in a hospital, they become stabilized, they become competent to stand trial, and they can work better with their legal representation to get adjudicated in the appropriate way.
Yeah.
So there's an opportunity there.
But I think of someone there was a case I think it was in 2018, Janice Dotson Stevens, she's long history with schizophrenia, arrested for criminal trespass, ends up in the jail for 6 months and dies there, and that's someone who could have been diverted to a psychiatric hospital or to a diversion center, and perhaps could have been reached or stabilized in that way. Jelynne, thank you for coming in. We could talk about this for much longer, but I think I really appreciate
Thank you.
your candor and the expertise you're bringing to this topic.
Thank you. Thanks for having us.
Yeah, thank you.